So this is John Goehle and Sue, and we're here at the Winter 2019 retreat. So this is John Goehle and Sue Cronkite. We're here at the 2019 retreat, and we have a lot of people here. This is a crowded studio here. So I'm just going to go around the room and have everybody introduce themselves. And what we're going to talk about today is just kind of some thoughts about the year and how things have progressed this last year. Alex, why don't you start?
Sure. I'm Alex Borneman, Director of Operations here at AHS. One of my specialties...
Why don't we just introduce ourselves around first, okay?
Again?
Yeah.
I'm Alex Borneman, Director of Operations here at AHS, and I also specialize in life safety and emergency preparedness.
I'm Jenna Alvarez, Senior Nurse Consultant and the Startup Specialist, I guess.
I'm Zach Calaritas, Consultant with AHS.
Darcy McCloy, Administrative Assistant with ASS.
And our newest employee as of...
Welcome.
Welcome
Say it
on
again.
board. Go ahead. Go ahead, say it again.
I'm an ASS.
And this is why we have the
The rest of the asses.
Oh, Lord. Help me.
Do it again.
I'm Darcy McCloy, Administrative Assistant with AHS.
I'm Judy D'Ambrosio, Senior Consultant with AHS, also the Director of Education.
And of course, John Goehle here, owner, and
Sue Cronkite, Senior Nurse Consultant.
so this is the time of year. We just, by the way, just finished our annual winter retreat, and we just thought we would sit around the microphones here in this beautiful new studio with enough microphones that everybody has their own microphone.
We may have dragged a couple of you kicking and screaming, but we've got you all here.
They are true, and Darcy, of course, is raising her hand because she's the newest employee, and she's afraid that we're going to embarrass her. But we're all going to be very nice to her, right?
Well, we will embarrass her.
So I thought as we end the year, as we move into the next year, we would talk a little bit about, just some takeaways from the year. It's been it's been quite a year for Ambulatory Healthcare Strategies. We've grown considerably. We're now up to 14 employees, Darcy being our newest one. I think about a week now, Darcy?
A couple weeks.
Yeah, and Darcy is one of our part-timers. She actually works for one of our clients as her full-time job. So we do have, we have 6 full-time employees, and really everybody else is either a 1099 or we also have, a lot of per diem people such as Darcy. So Alex, I thought I'd have you kick it off here and talk a little bit about some of the takeaways, especially on the life safety side.
Sure. One thing that's really come up this year is, and largely a part of a lot of the surveys that we've come across, is the importance of hiring good contractors.
Yeah.
A lot of centers that we've run into have hired contractors that really... Hey!
Just looking at the...
Hey, peanut gallery.
These long gaps between words.
Oh, stop. You're
Go
doing
ahead.
fine, sweetheart.
No,
I will try to talk a little bit faster
Nope.
here.
No louder.
Okay, you're
though.
not doing a lot of it. Where did he stop? Or where did you...
You're talking about contractors.
Yeah.
the importance of...
So when we're talking about contractors, especially when it comes to life safety items, the importance is to make sure that they are competent, and when they're fixing items for you, that they're fixing them properly. Because if they don't, then the surveyors could come back and cite you yet again, and that really escalates things and loses your
Like the credibility, I think, almost, isn't it?
yeah.
And plus, you can lose your credibility, I think, and I think with life safety stuff, at least for me, it's not stuff that I can just look at and know. So whereas a lot of things you can fix them and you can just know common sense wise, or you can follow what the surveyor said to fix. With life safety, they really have to be an expert, unless you're going to crawl up in the ceiling or all of that. So I think it's a good point.
Exactly, and I mean, a lot of places hire, mom and pop shops to do their contracting, which you know, if they're trustworthy and they know what they're doing, they can be fine. But really vetting them is important up front.
Right, and double checking their work afterwards. Just don't assume that everything is right. You should be looking at it. And if you have any questions, obviously you should be using people that have a license, if there's a license in that particular specialty. So yeah, I mean, we've seen some issues this year with you know, kind of shoddy work being done that had to be corrected later. So that's a very good point, Alex.
Yep. And specifically, we're talking in terms of, you know, your firewall and maintaining the doors in your center. In addition, doing the ongoing checks, inspections of your different systems, and making sure those are done on the proper basis, whether that be quarterly, annual, monthly, daily, whatever it is.
Jenna, welcome back, by the way. Jenna's been on disability and for the last couple weeks, and today's your first day back, so welcome back. We've all missed you.
Welcome back, Jen.
Thank you.
So while Jenna was gone, all of us had to take on some extra burdens here, and we really are grateful, and I know our clients are very grateful to have you back. So welcome back, and what's been your takeaway? You've had a pretty easy year. I mean, really nothing going on. You know, startups are so easy. There's never any issues. So I don't know what you're going to talk about.
Well, like he said, I have quite a few startups going on. One finally opened, so that was
While she was on disability.
While I was out.
Good
Well, no,
timing.
They opened before I went out, but they had their survey and passed,
True.
thankfully, while I was out. So.
Yeah, we didn't screw things up on that. So.
And I have a couple more that are gonna get there, but as anyone who's started a surgery center probably knows, it is never on the timeline that you initially think. So if you have a date that your contractors tell you you're gonna be ready to start, I would add about 3 to 6 months to that.
So Jenna, let's use a statistic. Out of the 5 startups that we have, how many started on time? Just give me a rough number.
That would be
0?
0. One was delayed only by 2 months.
Yeah, that was the
But
closest.
that was about the shortest of my startups. That and the other thing is that we've been learning with all of our startups, especially when we've come into projects after they've already started construction, is it's actually a good idea to have a life safety surveyor come
Yeah.
in before the building is done, because they at least in 2 or 3 cases have found things that needed to be fixed prior to survey. So
Right.
And major items too.
major.
Yeah.
Not little things.
Yeah.
Well, and
Maybe
I tell the
too
story
easy.
with the client you're referring to that when they hired me, actually even before they hired me, I walked in and within 5 minutes I cost them $250,000 because the whole setup was wrong. There was the sterile corridor was in the wrong place, and they had to move literally half the surgery center, 3 feet to the west. So it really, as you said, Jenna, the money that you spend for a good life safety surveyor, we have them, of course, is well worth it in the very beginning.
And also, like Alex said, good contractors also make a difference
Yeah,
when you're building hiring people who have built surgery centers before
right.
is important.
That's right, and that has been a major issue in this past year, is that I think, a lot of times, physicians hire people that they've known. Maybe they built their home, I don't know, but they're not hiring people that have a lot of expertise in the ASC area, so that's a very good point.
And it's important to think about too with contractors, whether it be engineers, architects, or just regulatory consultants. Each of those sets of people have different specialties that
Right.
they're focusing on, whether that be state regulations, federal. I've seen architects that are building to the international codes rather than NFPA, which of course in ASCs we need to build to NFPA and FGI.
And I think that's an important thing to note here too, is that this isn't just relevant for people building new surgery centers, but if you're expanding, or even if you're just adding something. We have a client right now that is putting a new doorway into the linen closet, and major project that requires, some work that is gonna be governed under FGI. So, you have to be very careful to make sure the construction is done properly. And by the way, Jenna, what do you have to do anytime you have any construction project in a surgery center?
A risk assessment. Let me say it again.
Yeah.
A risk assessment.
That's right.
And also, under the new HHC guidelines, all of your employees need to be able to tell the surveyors, well, at least your administration needs to be
Right.
able to tell the surveyors that that's what they're going to do during construction. They need to be able to verbalize that they know the proper process during construction.
Correct. So, risk assessments are another big thing right now. We've done a couple episodes where we've talked about risk assessments. So, if you haven't listened to those episodes, please do. Any center, startups or ongoing centers are gonna have to do certain risk assessments as they go along. Any other takeaways, Jen? Okay, no
I think
problem.
we all have a takeaway that once we help take over some of Jenna's clients, we realize just how busy she is trying to open up these places.
It's
Well,
no
there's
There's a
just so
lot
many.
involved in
I guess that is. There are so many moving parts that,
Mhm.
especially, quite a few of my clients have come from an office-based setting
Yeah,
to
right.
a surgery center, and it's different. And adapting is not always easy.
Right.
And just all of the things, in addition to getting all of the construction done and watching over that, all the administrative stuff and the staffing and the training and the policy work, there's a lot of moving parts that are all going on at the same time. And honestly, with the construction delays, it is nice because it gives the nurse manager and the administrator, and it's not nice because you're losing money with the
Yeah, right.
when you're not opening, but it does give you a little bit of extra time that you probably actually are going to need on the administrative side as
Mhm.
well to get ready to open,
Right.
that you don't necessarily always know you're going to need at the beginning, because things take more time always than you are
What do you expect?
expecting.
And there's a number of choke points too with the construction schedule, including things that we found with like A55B and approved procedure lists, things that you just really can't move forward without.
Right. And make sure you work very closely with the accrediting organizations to make sure all of the, that everything is ready for you to push the button when everything is done. So work very closely with them as the construction is underway. Zach, now you're coming up on 1 year with us, so I'm sure you're gonna have some great thoughts. What's your takeaway from this year?
Well, I guess in my first year with the company and even in the industry, I guess my biggest takeaway would be just I'm thankful to be around a lot of people and who know what they're talking about. And can I say that again? Or-
okay.
Thankful to be around. Sorry, I'm trying to figure out.
People, passion, things like that.
Yeah.
It's a different environment than widgets.
Yeah.
Things like that.
I'm thankful to be around people who know what they're talking about and are very forthcoming and passionate about. I'm trying to say knowledgeable, help me learn. I'm thankful to be around people who are able to share knowledge with me and help me learn a lot about the industry. I've been fortunate enough to go to a couple conferences and just really learn more about the industry, and I'm thankful for the opportunities I've had and for what's to come.
And thank you for being our youngest employee here. But it's a lot to learn, isn't it? In the amount of time that you've been with us, and of course you're just starting to pick up clients now as
Yep.
we bring you on board. Doing more individual work. A lot of your work has actually been in the finance area.
Yeah.
So one of the things that we probably should mention is that as we move into the new year, we are probably going to be moving into a little bit more finance than we've done before, perhaps adding to our service mix, some of the services that we actually offered in our beginning years and kind of backed off on as the regulatory area got kind of big. So Alex and Zach, who have a finance background, will be involved in that. So if your organization needs, monthly, quarterly, annual financial statements, that's another area that we're getting into, and Zach and Alex are going to be very much involved in that. So you're going to be able to use that section of your degree. Actually, Zach, you have 2 bachelor's degrees. You have a double major, don't you?
Double major, yeah. Business management and finance.
That's right. So we're definitely going to be using that much more so than Alex's international, management degree. And
Hey, I mean, I speak German. That helps in the ASC world, right? Lots of patients that speak German. Never mind.
Yeah, exactly. How many clients do we have that German speaking? What's that number again? Just give me a rough estimate.
0.
I'm going to put poor Darcy on the spot here. So Darcy is our newest employee. About a couple weeks, as you said. She's administrative assistant working with us here, and she's been with us for 2 days, kind of getting the ropes in. So Darcy, you actually work for one of our clients, and the reason I really want to put you on this kicking and screaming is because you came from the hospital environment. So I think it's always interesting to talk a little bit about what did you find shocking? What did you find interesting as you transitioned from a hospital environment to the ambulatory environment?
Hospital environment definitely is way more political.
Yeah.
More hands trying to stir the pot, and you get into the ASC side of life, and it settles down more.
Right.
You have patients walking in that don't have that huge look of fear that
Yeah.
walked into a 6-story hospital or a 3-story hospital. They're walking into a smaller environment, and they're definitely getting more one-on-one care than they ever would in a hospital. You've got someone in pre-post-op that's got one nurse that's taking care of 4 patients. Typically, you're going to be one-on-one when you're in an ASC center, and
Right.
the care is totally different. And you've also got wonderful organizations like ASC.
AHS.
You've got organizations like AHS that you can reach out to at any time and get answers and get help, a phone call, email, or in person. They're there.
Right.
And you don't always have that support through a hospital at all.
And that was
So.
a paid advertisement. Thank you.
Good
job.
It's
Yeah.
true.
Careful with your hands. Yes.
So I think the comfort of the patient level, which is always one of our goals, and even keeping the doctors happier is a lot easier in a smaller setting, and it just goes much smoother.
Yeah, I mean, to that point, we can never forget, our mission and everything that we do in ambulatory is geared toward improving the patient experience and improving the physician experience. And we should never forget that hospitals are great for what they have to do, but they obviously have a much higher level of care that's expected in that environment. And here we are trying to take care of those patients that don't need to be in a higher risk environment, or who wants to go to a hospital, who wants to take that risk of getting an infection, for example, when you don't need it. And that's what ASCs exist.
And they succeed.
Okay, Judy, you're obviously very shy and don't
Yeah,
really have
that's
much
me.
to say. So what's your big takeaway? This has been an extremely busy year for you too.
Yeah, I had a few startups of my own that I couldn't have said what Jenna went through, any better. Always allow yourself just about twice as much time as you really thought you were going to need. And yeah, there are just so many moving parts. That was a hell of an experience for me doing that. But beyond that, what I found really interesting about this year, and it started early in the spring, when I found out that New York State especially was really cracking down on radiation safety. We had one center out here in Western New York that had a survey, a radiation survey, and because we are in proximity, I drove out there to be with them. And I was speaking to the surveyor, this pleasant young girl, who explained that New York State had hired, up to 100 new surveyors because they were so far behind in the books, and that people would be held to a higher standard, that they were going to be visited more often, and their safety plans more regulated. And she couldn't have been more right. We've had this come up quite a bit this year, far more so than any of the years before. So I was able to go back to my previous life, where I worked in radiology before I was here with John, And I've really been able to help clients make sure that their quality improvement plan for radiation is up to date and working well, that the documentation they need is there. And I know this is daunting for some centers because it really hasn't been part of what we've offered before. And sometimes something that gets sort of thrown by the wayside or just, a forgotten aspect. So if you're in a position where you want to make sure that your radiology program is up to date, please reach out because we're here to help you. We'll make sure that if DOH does decide to come knock on your door unexpectedly, we'll be able to get you through that. Because we were forced by fire to learn a lot about that this year.
Yeah, it's never really been part of our service offering, but for all our clients that are listening, it's one of those things we'll be rolling out for all of our clients that have, that use, C-arms or other types of x-rays in their operation over the next year. And we will be doing a special episode. We're still, we are way behind in our episodes right now. We got still a bunch of interviews that we have backed up from the last couple conferences that we attended. As well as, just some material that we just know that we have to get out there, but we're gonna have to talk about.
Yeah, I'd like
radiation
that to
safety
reach out
stuff.
to as many as possible, before DOH shows up.
Right.
I'd like to give them that opportunity, yeah.
Sue, what's your takeaway from this year?
A lot of what everybody was talking about, the different surveys, I know there have been a couple of articles that have come out, which we won't get into a lot, but talking about the ASCs not being highly regulated, but there's AAHC, there's New York State, there's the
CMS,
tissue
and,
banks.
yeah.
Right.
You have the like you said, the radiology checks. I mean, there's so many different aspects. It seems like over the last few months, it's been one after the other in our centers. So learning how to do the plan of corrections and helping them with the plan of corrections and all that type of thing. It really brings to point how well regulated it is and how everybody really works to make sure that standard of care is really great.
I think it's fair to say that, does anybody around the table feel that we live in an underregulated industry?
No. And what is the number of people who believe
What
it?
is-
Nice round number,
Yeah,
it's zero.
that seems to be our running joke today.
That's right.
0.
So, and that does bring up an interesting topic, which we talk about a lot here, is that, when I got in the industry 30 years ago, I did feel like I could wrap my arms around the regulatory side. I could wrap my arms around, I could wrap my arms around the financial side. And I'm not sure that anybody running a surgery center today, and still being able to make sure operationally everything is working well, can do that. I mean, I think that's why organizations like ours exist, is that, understand, and one of our ongoing things here is that we can, am I missing something?
The children.
She's on her phone.
Oh.
I was texting
I
back your
kicked her.
sister,
Oh.
but then I got distracted by something.
Don't leave me hanging with the editing, so go back.
What was I talking about? Oh, I think it just brings up the importance of having at your fingertips, resources, whether it's books or knowing where the websites are, or of course having a resource such as Ambulatory Healthcare Strategies that you can call on, or the podcast. I mean, I think we've heard a lot of good feedback this last year about the podcast and how important it is, for those listeners that want to stay on top of things. So.
And as we said a lot of times, the state associations,
Right.
going to those conferences,
National
meeting people,
conferences.
networking, there's always support in this industry.
Yeah, it's easy to feel like you're isolated. And I think that's one thing that we find so often. We go into a new center. Alex and I were out this last week with a new client in the New York metropolitan area. And, we really felt bad for the people that are there, a lot of turnover recently, and suddenly they are, they're confronted with having to do everything. And recognizing that they could, call upon resources was very important to them.
Yeah, that's a good point, and I feel like a lot of people in our industry don't realize that, because so many come from the hospitals where, you can just look at a different department for support, but in the ASC industry, our support is our other centers, consultants and all of these bodies,
Right.
you know, state associations, national associations that are all there to help you.
Right. You know, policies and procedures we all share, you know, willingly across organizations. I can't imagine anybody ever copywriting policies and procedures, since we've pretty much stolen them all from other organizations over the years. I don't even know where some of our policies came from, and they've probably been modified so many times that you couldn't even recognize them from their initial source.
And by the same token, we like to give our policies out
Yeah, that's right.
for free.
And to that end, you know, we do post various policies on, you know, on our patron, you know, for our patron members here. So don't hesitate to, well, you know, first of all, think about joining as a patron member, but recognize that that database is growing as we go along. So does anybody have any New Year's resolutions?
Don't believe in them.
I hear it's only $10 in my town to join the gym. So that's one
So
of the things
your
I'm looking at.
resolution is
Yeah.
to join the gym.
Yeah,
Okay.
a new rec center that was just built here in Henrietta. So.
Okay. So we will hold you to that.
Pretty
when we come
classic,
to that.
right?
Yeah, that's right. Let's see how long that lasts.
Yeah. Talk to me January 5th.
Oh, you're not giving yourself long at all. 5 days.
And Judy's resolution probably involves baking.
Probably, yeah, I'm working on my keto recipes. You know, I have a table here now full of guinea pigs. Okay, try this, see what I can change. So as they help me hone in on my baking skills, I'll probably.
Very happy and willing guinea pigs.
That's right, that's right. Nobody suffered through the, and actually, I don't even feel guilty with the stuff that I ate today, when you told me how
Yeah,
low in carbs
we
they were.
did pretty well from a keto point of view.
That's right.
Hey, wait, you're calling us guinea pigs?
Well,
I
thank
know.
you.
Yeah.
Well, thank you, everybody. It has really been an incredible year. It's, I just want to, you know, publicly note, I just want to publicly, you know, state what a pleasure it is to work with such a dedicated team of people, and you know, it's been a bang up year for us here at Ambulatory Healthcare Strategies, and certainly on the podcast. Now, I guess we have a special treat for our listeners, correct?
We're not sure. It will be a treat.
I'm not sure it's a treat.
Well, I do have control over the board here, and the microphone, so
On
if
my
it doesn't
mic.
sound good, I guess we. So, our resident
What are you gonna
musician,
call me now?
our resident musician has written a little song.
I am, but I ain't singing it by myself.
And I believe this is partially by request,
Yes.
at least the skit portion of it. Yeah.
Yes, actually, that's true. We did have a listener of ours complain about or comment that they would like us to go back to having some of the skits. And those of you that have been listening since the first couple episodes know that we used to do skits. So we are going to be adding some skits over the next couple months.
And we want to remind people, so please let us know what you like, what you don't like, because we're always willing to, you know, tweak things as we go along.
And again, what is that address, everyone? It is comments@ascpodcast.com. So here's our treat for you. And from the studio here in Spencerport, New York, the AHS Choir. And here we go.
Someone's gonna
Nobody wants to be the first.
I'm certain
With
key.
harmony.
On the first day of survey, my center gave to me a patient with MRSA. On the second day of survey, my center gave to me 2 misplaced charts and a patient with MRSA. On the third day of survey, my center gave to me 3 patient falls, 2 misplaced charts, and a patient with MRSA. On the fourth day of survey, my center gave to me 4 grievances, 3 patient falls, 2 misplaced charts, and a patient with MRSA. On the 5th day of survey, my center gave to me 5 unwashed hands, 4 grievances, 3 patient falls, 2 misplaced charts, and a patient with MRSA. On the 6th day of survey, my center gave to me
6 souls a beeping, 5 unwashed hands. 4 grievances, 3 patient falls, 2 misplaced charts, and a patient with MRSA. On the 7th day of survey my center gave to me 7 cell phones ringing, 6 Zolls beeping, 5 unwashed hands. 4 grievances, 3 patient falls, 2 misplaced charts, and a patient with MRSA. On the 8th day of survey my center gave to me 8 nurses quitting, 7 cell phones ringing, 6 Zolls beeping, 5 unwashed hands. 4 grievances, 3 patient falls, 2 misplaced charts, and a patient with MRSA. On the 9th day of survey my center gave to me 9 patients puking, 8 nurses quitting, 7 cell phones ringing, 6 Zolls beeping, 5 unwashed hands. 4 grievances, 3 patient falls, 2 misplaced charts, and a patient with MRSA.
We're almost there.
On the 10th day of survey my center gave to me 10 doctors screaming, 9 patients puking, 8 nurses quitting, 7 cell phones ringing, 6 Zolls beeping, 5 unwashed hands. 4 grievances, 3 patient falls, 2 misplaced charts, and a patient with MRSA. On the 11th day of survey my center gave to me 11 IVs blowing, 10 doctors screaming, 9 patients puking, 8 nurses quitting, 7 cell phones ringing, 6 Zolls beeping. On the 12th day of survey my center gave to me 12 no-show patients, 11 IVs blowing, 10 doctors screaming, 9 patients puking, 8 nurses quitting, 7 cell phones ringing, 6 Zolls beeping, 5 unwashed hands. 4 grievances, 3 patient falls, 2 misplaced charts, and a patient with MRSA.
Merry
Wow.
Christmas!
Merry Christmas from
Merry
Ambulatory
Christmas.
Healthcare Strategies.
Okay, it wasn't
Good
bad.
job, guys.
Hey, yeah,
Now
I
you're
thought
gonna
pretty
I
proud.
hadn't read down and
I
we
literally.
we both
I looked at the
laughing
dogs
about
were
the
singing.
7 nurses quitting.
Yeah.
I feel called out.
I thought it came, I mean, since it did at 3 o'clock in the morning, I don't think it was too much.
The dogs were singing too at one
I
point.
know.
Yeah.
I
Yeah.
heard that.
Saxon likes to sing when Happy Birthday sings, so
Yeah.
we probably just didn't realize it wasn't Happy Birthday.
Yeah, that's true.
Well, thank you, everybody.
That was fun.
The microphone's off here, but that one's still ringing. So.
Yeah, that'll be good.
If you pull the chair in, pull the chair back out, please.
Oh, that was a lot of fun.
Saxon.